we are closing out these last few days of March with the amazing women of the Holistic Business Network. So we have been having a Women in Wellness series all month long, and today I have the pleasure of speaking with Dr. Martine Forrester Cadet, who is a holistic dentist. She also has a way and a technique that helps you sleep better. And we were just together yesterday at an amazing health fair, and I got to hear her talk. I'm going to post that video in a little bit. And guess what? If you want to meet her in person, she will be speaking at our Holistic Capital Exchange event tomorrow in Boca. So she's just all over the place with us because we love her. She's one of the newest members of the network, and she brings so much value. You know, I have been wanting a more holistic dentist to be a part of the network as a resource, and she's all in, and her credentials and all the things speak for themselves. So I am just waiting for her to jump on here. Hold on, let me see if I can request, but I don't think she's on. I don't see her. Hey, Myrna. Hey, Pediatric Wellness Concierge. Hopefully I get to see you in Boca tomorrow. I think you're in that area. I'm referring to Pediatric Wellness Concierge. I think you're in like the North Broward. Hey, Myrna. Empower Financial Wellness. Oh my gosh. So many good things. Oh, hold on, let me go back to I just told her I was oh, there she is. Yay. Okay, this is the part that can be awkward when you're hosting these lives. You have to fill the air while you're waiting for your guests to be here. So I'm bringing in Dr. Martine. She's usually very busy, so gonna get what we can get from her. If you don't get enough information on this live, guess. Okay, I just invited you. Oh, no, to let you right in.
Yes. How are you?
Good. Hi, Dr. Martine.
Oh, you have
Okay.
some good light. I need better lighting. Okay. I've
I'm,
never done a
I'm
light. So,
really,
mm,
listen, do you know how many people said that this month? And I was like, oh, what a joy for you guys to go live with me for the first time. That's awesome.
I'm gonna go live and sit outside so I get good sunlight like you.
Oh,
Mhm.
yes. Outside is going to be really nice. The weather is gorgeous too.
Yeah.
Oh, you should have let people see the beautiful office. Her office is beautiful, guys. Um, okay. Enjoy that 70-degree something weather. Beautiful. Okay. Yes, the lighting's better.
Okay, good.
So, those of you that saw the title of this, so Dr. Martine, I don't know if you saw the title because you probably just jumped in, but I mentioned, I said, did you know that your dentist can also help you sleep better? And so I said, I'm going to be having a conversation with you because not only are you a dentist, you're more on the holistic side, but you also have a way for people to sleep better, which always intrigues people because I saw the reaction yesterday at the health fair. Every time I'm with you and I hear the topic sleep, it like people's ears just ping because I realize there's a lot of people having sleep issues. Um, so before we go into all of that good stuff, because you have many skill sets, do you want to tell us your background first, and then we're going to get into the conversation?
Sure. Well, I'm Dr. Martine Forrester. I practice here in Boca Raton, Florida. I focus on mostly adult patients, treating them in holistic, comprehensive dentistry, which means we make sure we make that oral systemic connection and we utilize the materials that are biomimetic and mimic our natural body um, composition, right? So we don't want to be putting things in our mouth that could potentially leach and leak and harm the rest of our body. And at the same time, I check your airway because when we look inside somebody's mouth, it's the first place that we access the environment, and we were able to check if they're breathing properly and exchanging oxygen properly, and if the oral tissues are set up to make that optimal. And if not, then we make sure we get our patients tested to see if they have something called sleep apnea, and then offer an option, which is a non-invasive FDA approved oral appliance that people can use instead of a CPAP.
So good. So good. So guys, I saw this device and I was amazed because it looks to me like a retainer. I had braces and so I still wear a retainer. And I'm like, something like that can help you sleep better versus I don't know if you guys have seen a CPAP machine, but I am claustrophobic and I don't know if I could ever do it because I'd be so scared to have that thing all over my face like that. So
And
that
even
is
the
just
newer CPAPs, to be honest, they've tried with making it not so big and bulky. But yesterday, while we were at the Women's Health Fair, Michelle, a lady came up to me and she said, I have a CPAP with just the little nasal pillow. And she showed me photos of her nose all inflamed, having like pimples on her nose. And she said, I've tried the small, I've tried the medium, and I've tried the large, and I just still cannot get comfortable. And I was like, that's had this issue. And that's for people like that, knowing that there's an alternative, right?
yeah,
That is effective in treating and doesn't warrant surgery, right? Is a really
yep.
good, and that's why we go out into the community to let people know that this option exists, because most people have never heard of it, right?
So you're right. And listen, someone like me, Dr. Martine, I'm always up on what's trending in health and wellness, and I'm big into like dental health. I've had so much work done, guys. I've had a lot of things done in my mouth, but not because I had issues, just I had braces. I pulled tons of teeth for them to do the braces. I've had a root canal when I was really young. Like I've had a lot of things done. And so I'm always like listening. And so when I met you, I didn't even know this existed, like to have an alternative to a CPAP. So I just love having you and sharing your message because there's a lot of people out there, like you said, like this lady yesterday is suffering with another device that's causing her more issues outside of her sleeping. We want people to live better and know that there's solutions, that they don't have to suffer through what they're going through. So I love, love, love this so much. I love it. Um, and then what I also love about dentistry, and for anyone watching, if you don't know this, that dentists, they're not the like typical physician that you go to, but dentists can see so much that's happening in your health just from looking in your mouth. And I learned this over the years of being deep in the wellness community, and I was surrounded by dentists and all these other practitioners. Dentists can see things happening and
Sometimes
make
we
you
see
aware.
diabetes before your blood work. Sometimes we see, you know, um, leukemias, right? Bleeding gums can be the sign of certain cancers. I mean, there's so many things that you can see if you pay attention, if you're trained to look in somebody's mouth and see these things. Sleep apnea being another one of these things. And so, yeah, being holistic just means that also means that you're understanding that there's a great oral systemic connection, and
Mhm.
listening to patients' histories and listening to what their complaints are, right? Because paying really close attention to, I firmly believe that my patients know themselves better than I know them. So if they are telling me something, right, I'm listening to what they're saying,
Yeah.
and I'm really paying attention to how I can help them, right, live better, right, live more
Mm.
fulfilling lives, and now also live longer, which is amazing.
Yeah, so okay, so just to touch on everything you've already shared. So for those of you that have joined us, I'm here with Dr. Martine Forrester Cadet. She's a dentist in Boca, and she also has a service that or a contraption she has for people that have issues sleeping that helps you sleep better. And she's also a holistic dentist, all the things. So one of the
I
things,
call it functional cosmetic dentistry, right? To make sure that even though you should love your smile and it should look beautiful, right? We all want a nicer smile that makes us feel confident. There's a
yeah,
psychological component that comes with, being on a live talking to you with really nice teeth versus some, people's personal feelings of being unable to do something like that, right? Because you're self-conscious, right? And nobody should live a
yep,
life like that, right? So it needs to look
yep.
pretty, but it has to function well, right? And it should last you for your lifetime, right? So I think those are great focuses. And when you treat sleep apnea, you live like at an average of 3 years longer than somebody who does not treat sleep apnea. You know, there's a
See that I'm so glad you just said that. Go ahead, because I was just about to ask you about because there's less oxygen going to the brain and the body, right?
Yes, so you have a higher risk of dementia and just cognitive issues as you age, right?
Mm-hmm.
Because the brain isn't getting deep, restful sleep, rejuvenative sleep, and you're unable to, it puts a lot of stress on other metabolic um, systems in your body. For instance, there are a lot of people who end up having strokes in their sleep because their hearts are working really hard trying to supply the oxygen that the brain needs, and without that oxygen, we all know, right? The reason we in live on planet Earth is because of the oxygen supply. And so our brains need it. And without that oxygen, we're really stressing, putting a lot of stress on our body and on our heart. And it can have very, you know, terrible effects. People can die. And people have died from it. And so sleep is the new exercise. I'm sure everybody has heard that before. And in order to exercise, you still need to sleep well. Just in order
Yeah.
to feel better, you need to sleep well.
So you bring up a really, really good point, right? Because a lot of people that follow this page, if they're probably wellness enthusiasts, but they're also in wellness themselves. And you I know I'm guilty of going to bed late, but I when I do wake up, I am rested. I think there's a lot of people that go to bed and they don't wake up rested, and they don't know why, because they don't realize they didn't have enough oxygen going to their brain and going into, in their body, like Dr.
Yeah.
Martine just said. They're everything's struggling because in your sleep you don't realize, but then you wake up not rested, right?
And I mean, so there, I mean, there, getting restful sleep is definitely multifactorial, right? You need to figure out what your particular issue is, right? But I think we shouldn't think that not being restful is just a part of rested is part of aging, or just something that we deal with and compensate with caffeine, or you know all these other things that taking more things, because our body's natural state is to recuperate after you get 7 to 9 hours of sleep, right? So you
Mm-hmm.
shouldn't wake up feeling tired, and if you do, then you shouldn't stop looking for what your issue is. And it might be more than one issue. We spent a lot of time yesterday talking about hormones, right? And
Mm-hmm.
perimenopause and what that is. But a lot of times, it's also structural. It's also apnea, which is when you have reduced airflow, which causes low oxygen to the brain. And when you have low oxygen in your brain, it creates a very stressful environment for your heart. And it can lead to just overall inflammation, right? You know that word? Inflammation is not a good thing to have anywhere, right? And so when you look in somebody's mouth, you can see when they're snoring, right? People said to me yesterday, I don't have apnea, I just snore. Okay. And this is this is the precursor to apnea, right? But
Yeah.
snoring is also not a normal physiological state, right? People who snore are reducing their airflow. You're making that noise because the the air is being restricted as it comes into your lungs. And so
Wow.
snoring is just not snoring, right?
It's
Snoring
an
should be
indicator.
addressed, right? Should be
Yeah.
addressed. You may not have apnea yet, right? Because there's a definition of how long you have to desaturate or lose oxygen in order for it to be considered an apnea. But you can
Hmm.
still have reduced airflow, which just because you haven't gotten to the threshold still doesn't mean you're not stressing out your body, right? So I would
Yes.
I would address snoring 100%. And hopefully you're not at apnea, but hopefully you never get there if you address just the snoring.
So
Mhm.
what if you snore like occasionally? It's not consistent. Even then, you recommend that?
Because a lot of people snore when they sleep in certain positions, right? So you're more likely to snore if you sleep on your back, right? Because of physiologically what happens to our tongue posture when we're lying on our back. But you can't
Oh,
control how you sleep or how you snore. But if you're snoring for long enough, right? Even if it's occasional during that one night when you snore for a certain length of time, you are putting stress on your body at that time, right? Some people snore
oh,
more when they're drinking, right? That's because all their muscles are more relaxed at that time, and the tongue is a muscle. So if you have a really restricted airway and then you're relaxing your tongue, all of a sudden that alcohol just makes it more relaxed, and now you're having apneic episodes. So if you have a propensity for snoring, I would still look into a, a snore guard or a mouth guard that stops snoring, so that you don't have that, you don't run that risk for sure.
oh,
Not to
that's
mention
good.
our partners usually really appreciate no snoring, right? It's
Yes.
disturbing. It's disturbing to the other people around us, even not in the same room. I have kids telling me they hear their dads or their moms snore, or sisters or cousins snore, and people don't think they're snoring. But
Yeah.
if other people hear you and they're not sleeping next to you, that's really loud snoring.
Yeah. So that means you're really struggling. I know there's like every 3 or so months, my husband will be like, "Oh, you were snoring so loud." And I was like, "Really?" And it's usually on a day that I was like maybe overly tired, but it's not consistent. So that's why I asked you that. And then, okay, so Dr. Martine shared something with me when I went to visit her office just like a month ago. And I was telling her how I mentioned I'd done a lot of work. I had to remove 6 teeth in one day, and then they put braces on me, and they were making my bite smaller, making my mouth smaller. I didn't have crooked teeth or anything, but they were just like, oh, your mouth protrudes. You should. And so she said, just from that process, that also has made my mouth way smaller. So I'm more
Yeah.
prone to have. So I'm just saying this as someone in her late 40s that this was a typical procedure. If you guys had something like that done, which Dr. Martine, you were sharing with me, they don't do that anymore, right?
No, for the most part, orthodontics is more about expansion than it is extraction. So as a
Wow.
profession, they're looking at airway, and they're understanding that even to straighten somebody's teeth, if you take teeth out, you bring things in, you're decreasing the amount of space that somebody has for their tongue. We can't cut your tongue off. I can't change your tongue, right? But what I can do is I can make sure that we're expanding as much as we can to give the tongue as much space as we can. So, even Invisalign, traditional braces, we're and now we have implants. So if somebody's missing a tooth, we're making room for that tooth to be replaced with something else, right? We're not just trying
Yeah.
to close gaps and close spaces, because we know that it puts them at high risk for apnea, which has severe deleterious effects on our overall health.
Wow. So I say this just because it's been 25 years since I did that. So now it puts me more in a category to have these issues. So if you're someone that had, teeth removed and braces and all those things happening because that's what they did back then, you might be suffering from snoring or sleep
Yeah,
apnea.
it's
Because,
I think one of the key take homes too is that you don't have to be overweight, right, to have
no,
apnea. right?
Mm-hmm.
And I think a lot of people think that you do. Oh, that's something for somebody with a certain BMI. But because it's a structural thing and people have had missing teeth, I mean, I have really petite ladies that have apnea, right? And when you're fully oxygenated, you wake up, you can tell the difference. Even
Mm.
brain fog, things like that, that we all assume is a natural part of aging, is heightened or worsened when you have apnea.
So, oh, and I want us to touch on this. Just so you guys know, Dr. Martine will be in Boca with us at our Holistic Capital Exchange event tomorrow evening. If you're not aware of that, we're having a networking event with some personal growth and all the things. Tomorrow's going to be great. Chef made light bites, all of that. She's going to be speaking. So you can get to connect with her one-on-one at this event. And if you have a personal question that you want to ask, you can ask her directly. But I really would love that topic of how people who are, especially entrepreneurs or other doctors, they need to know this because this might be an area that they've been challenged with and didn't know what it was, but it might be this is the issue and you can help them resolve their problem, and then they can wake up and be able to perform better throughout their day because they're going to feel more rested. Yeah,
Yep.
and have more
And have
clarity.
more clarity.
Yes,
Yes.
yes. So we're going to talk about this tomorrow too. I'm going to be interviewing Dr. Martine at the Kendra Scott store in Boca Town Center. Guys, you can go to the link in our bio to grab a ticket, but you're going to want to be in that room because there's going to be some really great conversations happening. But the main conversation happening will be with Dr. Martine. It's going to be really, really good. I'm not sure. Do you have a patient? I don't want to hold you.
Yeah, I got to run, but
Okay.
this was great.
Dr. Martin, this was really good. This is a teaser for tomorrow. Tomorrow you get to see her in person. Okay. All right. Thank you, Dr. Martine. I
Thanks,
get to see you
Michelle.
3 days in a row.
I know.
Amazing.
I know. What
What
a
an
woman's
honor.
Women's Health Month. Okay.
Yes. And this will be getting uploaded to YouTube also. So you'll be on YouTube also. So you're all over the place.
Thank you.
So Boca Dentique and the Deep
Deep Sleep
Sleep
Center.
Center. I'm
Right.
going to collaborate with you on this so anyone who follows you can watch this live because this is a really great conversation.
All right. Perfect.
All
Talk
right,
to you
take
soon.
care. Bye.